Hi, my name is Nicole, and I want to make another video with other residents to describe their experience in Beth Abraham Nursing Home in the Bronx, now a part of Centerlight Healthcare. And I'm here with another young resident he's not a spinal cord injury, um, but I'll let him speak for himself as to why he's here and what his experience has been here. So Marcus, why are you here and how long have you been at Beth Abraham?
Well, I'm Marcus Blacknall. I come from Yonkers, New York. I've been in Beth Abraham going into my third year, November 19th. I came here because I was in a terrible motorcycle accident where I was amputated arm and leg.
And upon coming here, what did your therapy and care plan consist of? And what were your goals?
In my accident, I came here because I wanted to. I wasn't paralyzed in my accident, thank God. So I wanted to be able to walk again, feed myself again, clean myself again. Because I also suffered a traumatic brain injury in this accident.
Yeah, so I noticed that your good arm got contracted, right? So did Beth Abraham do anything to prevent that or to minimize that?
No, they actually didn't. My good arm is very contracted, as you can see. When I came here, I came from Helen Hayes in West Haverstraw, New York, and I had a splint where I would put my hand in it every day. And yes, it hurt when they put it on. I came here with a splint. They went to put it on, and you know, I wheezed a little bit because of the pain. And the therapist looks at me and says, "You never had this on your hand. There's no way possible." And put it in my closet, and I never wore it again. And since I had a brain injury, I couldn't think to go to the right people or go back to them and say, "No, put this on my hand. I need this."
Wow. So tell me, how did the therapists and the nursing staff here at Beth Abraham execute that care plan to meet your goals, to walk, feed yourself, groom, and be functional as can be?
I will say Beth Abraham has done basically nothing towards that. It's been 3 years. When I got to my accident, I was not paralyzed. By now, I should have been standing.
Yeah, I think it's incredible that, and I've known you for the past 3 years, and that's the first thing I spoke to you about was making sure you get a prosthetic leg as soon as possible, and making sure that your good arm and your good leg didn't get contracted. And unfortunately, I've seen myself that they weren't very proactive in doing that for you.
Not at all. They would tell me to my face, I had a brain injury. It's not because of getting surgery or anything.
Who
My
would
brain
tell
injury.
you in particular?
Um,
Was it doctors, nurses, who?
Therapists. And
Therapists.
few years ago, it was a doctor. She was contracted here, and she would tell me, I'm so sorry, I don't have the name, but she told me straight to my face, you had a traumatic brain injury. Your brain is not sending a signal to your arm or your leg to work properly. So no, you're not going to be able to walk again.
Wow.
And I guess she expected for me just to take that and stay quiet, and I did. I
But
stayed quiet
there's
for a long time. I didn't know no better until my brain started to function more properly. And I said, let me call Jacoby. Let me call some people who worked on me already. And I went, got my EMG testing done. They told me every nerve in my body is firing as if I never got into an accident. My brain is sending a signal everywhere
wow,
perfectly.
wow. So in fact, with the prosthetic uh, leg, you are able to stand and walk, and with therapy, you can regain physical mobility
Yes, I
completely.
haven't walked yet, but I got my prosthetic leg maybe 2 weeks ago, which is horrible after 3 years. I got my leg a week ago, and next day I stood for the first time in 3 years.
That must have felt awesome.
It felt great. Now I'm sitting in a wheelchair. I'm used to being 6'1". I like to stand tall.
Yeah, that's right.
I always took care of myself, always took care of my body to, you know, live a certain type of life. And Beth Abraham stole that from me. They completely took that away from me after 3 years.
Yeah. So, can you describe your daily care here in terms of what you need and how Beth Abraham cares for you?
I wake in the morning, get a wash up,
And
and
how, I
breakfast.
mean, how long does it, do you have to wait to have someone, wash and dress you?
Depending whether it's a male orderly or female, male orderly is usually done pretty fast, and I'm out of bed by 11 a.m.
By 11? Well, that's kind of late in the morning.
Yeah, well, they do breakfast and
Oh,
you
so
know,
you do breakfast in bed first.
yeah.
Okay. Uh, so, uh, because you're not walking and you don't have functional hands, you can't wash yourself. You need them to wash you.
I am total care.
You're a total care.
Yes, I just got my prosthetic hand where I'm practicing to feed myself. Um, I can't feed myself with a fork or a spoon yet, but finger foods I could use my contractor hand to put it in my prosthetic and put it to my mouth. That's about it. I haven't tried cleaning myself or anything like that with my prosthetic hand, which is also another story because they don't help me much with my prosthetic hand. They gave it to me and basically told me to learn on my own. They just put it on. I didn't get no basic therapy to show, do it this way, try it this way. None of that. They just gave it to me and basically pushed me out the door.
So, from what I understand from the Nursing Home Reform Law of 1987, nursing facilities must care for residents in such a manner and in such an environment as will promote maintenance or enhancement of the quality of life of every resident. How has Beth Abraham promoted maintenance or enhancement of your quality of life?
They haven't. They haven't at all. Living in here, I basically feel like life is over. This is it. They basically, I feel they push the residents to make them feel like this is it, and it's gonna be this is how your life is gonna be, and that's gonna be. I don't feel like right now. If I went outside, I couldn't. I've been here for 3 years, and I went outside and with no help, I wouldn't make it. I wouldn't survive because I've been here for 3 years. I've gotten no steps forward,
Yeah,
and how to, okay, if I went outside, I could feed myself, I could clean myself, I could survive. Not at all. I feel they set us up so that we stay here and we
yeah,
don't get out.
yeah, and I agree. It's been an issue for me as well, and Uh, it's interesting that uh, as a quadriplegic, I have more function in terms of daily living skills. Like I can feed myself uh, and hold things, but it's been very difficult without hands, right? Functional hands to feed yourself, which is a very basic thing.
Yes, very
Um,
basic.
so things like your quality of life, dressing the way you used to dress, or I see that you like your head clean shaven and your beard manicured a certain way,
Yes.
and that takes maintenance.
Yes, it does.
Does Beth Abraham do that for you?
No, I've met I've met with orderlies who've helped me with it, but then they're told, from what I'm told from them, they're not supposed to shave me a certain way because it's against the rules. That I have to go downstairs and get done by the barber from here, which costs $15, and they take our money as it is. So if I gave my $15 for regular grooming that I'm used to in a quality of life, I will have no money for the rest of the week to eat out, order movies, anything.
Yeah, because so you have Medicare or Medicaid right now.
Both.
Both, yes. Uh, so you get an allowance of
Yes.
$50 per month, right?
For me, it's 30
Okay, they take out money for some other
because
kind of bill.
no, because somehow, some way, I don't know, they were sending my check somewhere and they didn't get a few checks, so they figured that I was getting the money, so they said I have to pay it back. So instead of getting me 50, they give me 30, while they take 20 extra every month to pay back that debt.
Okay, so uh, what what about things like therapeutic recreation or programs that promote quality of life, whether it be movies or outings? Um, has does Beth Abraham uh, give these kind of services? And have you been um, benefiting from those kinds of activities?
Yes, they give those services. They go to the movies here and there, and um, baseball games and everything. But honestly, that's a good thing. And yes, I have, you know, been to them with Beth Abraham, but I'm not here for that. I tell them I'm here for getting better to get out. So they could take us to baseball games and movie theaters and stuff like that, but I'm my story is bigger. I want to get back to the community.
Yes, I mean, and there's no reason why you shouldn't be able to.
There isn't.
I mean, if you have the function in your spine to walk again, you should be able
I should have
to do
been
that.
walking by now, but like I said, they took away from that, and it's horrible because if you don't use it, you lose it.
You lose it, yeah.
And if you don't use your hand, as you can see, my hand is contracted. My hand is contracted. If I wasn't standing up walking, so my foot and my ankle is contracted to where I had to get surgery. If when I came here, if they were doing their job and doing their surgery and stretching me and moving me around, those days, I don't believe those days were contracted like that.
Yeah. So tell me, so I understand also that according to the Nursing Home Reform Law of 1987, nursing facilities must provide services to attain or maintain the highest practicable physical, mental, and psychosocial well-being of each resident in accordance with a written plan of care. And it kind of relates to the previous one, and it's uh, making you feel you're a man in your own right, the way you were, um, whether it be uh, personal grooming, uh, 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 social work, encouragement to feed yourself, etc. Uh, how has Beth Abraham provided like services?
Pretty much they haven't. I don't. I don't feel. I don't feel anything like myself who I was. I feel as my past life I was always very independent. I did everything for myself. And I'm here. I feel like a child all over. Can't do anything for myself, and they don't promote or push to try to get me to get back to a regular setting of life. Get my prosthetic arm, I had to do myself. Get my prosthetic leg, I had to do myself. They didn't make the phone calls, I did. So they were okay with
Yeah,
me laying in the bed from day to day, just wasting away. They're okay with it.
yeah, and unfortunately, that's a lot of people in this facility, and they're young, and some of them they have conditions that unfortunately are progressive and or terminal, but there's others that are um, that if they had better therapy and services that they would be able to function in the community again.
Yeah, and that's why I feel Beth Abraham tries to set it up to where the young and the older could be here and get comfortable. They'll give you a room with a TV and a phone and a TV with channels and everything so you can feel comfortable. Like at home, you can lay in the bed daily and don't want to go to therapy. Don't want
Yeah,
to try to get to the outside world.
yeah, but when you're young,
You
you
got to try
wanna,
to fight to get out.
yeah, you could still work. You have your mind, you have your eyes and your ears. You know, we have a lot to offer. We're not just uh, lumps of meat in wheelchairs. We are people in our own rights um, that have things to offer. And I want to do this because I want to show people the reality of nursing homes and the fact there are people that want to live in the community and that can, but we're stymied because of certain physical and psychological issues as well as lack of services
I
from
feel
nursing homes.
I feel like we're warehoused here. We're just spots to fill these beds. As long as these beds are filled, I feel Beth Abraham is happy. I don't feel that they fill these beds with the look forward to we gotta get this young man or young woman back out into the community. They don't deserve to be here. I have not seen that in no way, shape, or form since I've been here for 3 years.
Yeah,
It's, you know, they try to hype you on medication and everything to make you feel you're okay to be here, tell you you're depressed and all types of things. And no, I'm a young man and I deserve to be back out in the community to live
yeah.
a progressive life.
According to the Nursing Home Reform Law of 1987, nursing homes must protect and promote the resident rights of each resident. How has Beth Abraham promoted and protected your rights?
I don't believe they have because they change what's written. They don't follow by what's written. They follow by what they want when they want. I've showed Beth Abraham rules and regulations to where no, you're not doing this right, and they will still just handle it the way they want to handle it, not to what's written down on paper, to the rights of the patient or resident. They just follow the way they want to do it at that moment in time.
And in terms of nursing care, have you noticed any changes during your time here?
Yes, I don't know what's going on with the economy or what, but for some reason the care and the nurses and nurses aides and everything has cut down a lot. There's a lot of cutbacks on a lot of aides. A lot of aides have been gone to where they're shorthanded by a lot of time. A lot of time, people, us patients and residents, we need aides, and there's maybe one nurse on the floor when we're used to having two. But I don't understand how the first, second, and third floor has two nurses usually all day. When you get to the upper floors, there's one to care for the same amount
Yeah.
of patients.
So
I don't understand
one
that.
to about 40
Yes.
residents. Yeah.
Yes. So why is it one to about 40 patients, but the lower floors is 40 patients also, and there's two?
Yeah, well, because it's the therapy floor where people get shown, oh, this is our facility. See, we have an RN and an LPN.
I've said that to
But
them.
once you're here long term, reality sets in. They move you to an upper floor.
Yeah, I've said that to them. I said, what are these, the glamour floors?
Yeah.
The glamour people, because as soon as you go, when you first, any human being, if you know friends or family, when you first go somewhere, your friends and family is going to come see you. They're going to come pay you visits.
Oh,
and
yeah.
when you come there, they're going to see a nice TV.
Oh, yeah. Nice phone. You get a brand new flat screen TV.
Yep. And they're going to say, oh, wow, you're in a nice place.
Yeah.
Okay. But that doesn't last forever. People get busy, and it's not that they don't care, but, you know, life goes on, and they stop coming as much. And as soon as they stop coming so much, they throw you to a floor with no TV and no phone. And I told them, I was like, I feel like that's a jail. Like, I feel like you're in a cell. No TV, no phone. Let's just close the door and look at the walls.
Yeah.
I felt that was very careless for them to do that when they did that to me.
Yeah.
And they really didn't try to help me out with it at all. They told me, well, you have family, get somebody to buy you a TV. And that's the care that you get here. I found it ridiculous when he did that to me.
So as a last question, how are you attempting to meet your goals now in light of your care here at Beth Abraham?
Honestly, from what I see, Beth Abraham can't help me with what I want. I want to be, I know I'm never going to be 100% of who I was, but I want to get back a certain percentage where I'm standing, where I'm walking, where I'm driving. And Beth Abraham has shown me basically kiss those days goodbye. It's been 3 years, I'm just now getting a prosthetic leg. If I got this maybe in the first year of me being here, I would most likely definitely be walking by now.
Oh, yeah.
If I had my prosthetic arm, I'm just now getting used to it. I'll most likely be feeding myself by now. My hand contracting, I gotta get surgeries and everything all over again just because I came here and they just warehoused me into a room and didn't do anything to help me. So me seeing Beth Abraham, you know, my care and stuff to help me get back out into the world, they didn't. I had to do this all by myself. I had to call prosthetic places to help me get a prosthetic. I had to call different hospitals to help me get surgery to get back on track, which I wouldn't have needed these surgeries if Beth Abraham was giving me the right therapy, the right proper care. I would not have needed these surgeries. Now I do.
Yeah. Yeah. Well, you gotta promise me that when you're walking, we'll do another video so people can see.
I will definitely come here and do another video while I'm walking. And I will do another video before I'm walking to let people know how it is to live in certain nursing homes and how things work out here.
All right. Well, thank you so much, and I'm looking forward to see you walk.
Well, Nicole, we've been here for a couple of years together. I've known you, so you will definitely see when I walk. You will definitely see me while I'm here. And if I leave from here and I stand up to walk, I will walk into Beth Abraham, give you a nice hug, and say hello.
All right. Awesome, Marcus.
Sure.
All right.
Anytime.